Urologic Health with Dr. Ricardo Gonzalez, urologist and FPMRS specialist.
You asked what the prostate is for. The prostate's a gland that we have as men that makes a seminal fluid where sperm swims. And as we age, the prostate will grow. And in some men, it grows to a point where it can restrict the flow of urination and affect our ability to empty our bladder. So it can cause difficulty getting started with our stream. It can cause an intermittent stream. It can cause where we can't urinate at all, which is called urinary retention. And more commonly, it can even cause frequency of urination, urgency of urination, and sometimes to the point where the urine comes out before we even get to the bathroom, which is urge incontinence. It can also make us get up at night to urinate. So as it grows, it can cause these things, and that can affect the quality of life of men. Most of these things are not a cancerous process, but rather something benign known as benign prostatic hyperplasia, or BPH. So how can we treat the enlarged prostate? Well, there's several things you can do. There's several things that are not surgical, which involve changing our diet. Some recommendations are avoiding spicy food or irritants like caffeine and alcohol. There's also medications that can treat the prostate. Very commonly, men are treated with a class of medicines called alpha blockers, which include Flomax, which is tamsulosin, but it also includes Rapaflo, alfuzacin, doxazacin, terazacin. These medicines relax the prostate and help the bladder empty better so that the stream is better, and it can also help with urinary frequency. These medications, however, do not shrink the prostate. The prostate stays the same size, but they treat the symptoms, much the way Tylenol can treat a headache caused by a brain tumor, but they do not change your prostate. Medications that do reduce the size of prostate are called 5-alpha reductase inhibitors. Those include Proscar, which is finasteride, and Avodart, which is dutasteride. Both are available as generic medications now. They can reduce the prostate about 30% in 6 or more months, but you have to continue to take the medicine to keep the prostate reduced in size. So medications like finasteride and dutasteride can shrink the size of the prostate with time, and taken in combination with medicines like the alpha blockers can relieve symptoms. And in many men, taking the combination of these two medications can avoid the need for surgery, assuming the man tolerates both of these medicines and stays on them the rest of his life. More recently, medications like tadalafil or Cialis have been used not only to treat erectile dysfunction, but to treat enlarged prostate. These medications like tadalafil do not shrink the prostate, but rather alleviate some of our urinary symptoms and make it easier for us to go. So those medications can treat 2 birds with 1 stone. You ask why some men need prostate surgery. Well, some men need prostate surgery for prostate cancer, but that's not what we're talking about right now. We're talking about benign prostate surgery. That's something that's much more common than prostate cancer. The prostate enlargement is what causes urinary symptoms, and if that gets to a degree where men have difficulty emptying their bladder, they're dependent on a catheter, they're not tolerating medications, and they want to make a choice, hey, I just want this problem fixed so that I don't have to take medications, they may opt to take to have a procedure done rather than to be on medications indefinitely. The goal of these procedures on the prostate is to reduce the obstruction within the prostate to help the bladder empty better. So by doing that, the flow gets better and the bladder empties better, hopefully reducing frequency and urgency, hopefully reducing the getting up at night, and in men who are in retention, hopefully allowing them to urinate on their own without the use of a catheter. The surgeries that are traditionally done to treat enlarged prostate involve using a cystoscope, which is a little telescope that we insert through the urethra. So we go through the natural orifice, no cuts involved, and we remove the tissue that's blocking the flow of the urine. Traditionally, it's called a TURP, or transurethral resection of the prostate, and in that case you use a hot wire loop to scrape out the obstructing tissue. Now there can be some bleeding, and you might need a catheter for a day or 2, but there are newer procedures that have come out that improve recovery and decrease risk with this type of surgery. There are lasers that we use, such as the green light laser, to perform a procedure called PVP, or photoselective vaporization of the prostate. That's where we use a laser light to treat the prostate tissue and convert it from a solid obstructing mass into a gas. So you vaporize it instantly. So at the end of the procedure, there's no blockage within the prostate. Doing that type of procedure reduces the risk of bleeding 5-fold over traditional TURP procedures. So that's an option for not only older men, but perhaps men on blood thinners or younger men who want to get back to work sooner. There's also something in between medications and the surgeries I just discussed, and those are called MIST procedures, or minimally invasive surgical therapy procedures. These are procedures that do not immediately remove the blockage in the prostate, but rather treat the tissue. The body has to resorb that tissue, and then symptoms improve. An example of that would be Rezum. Rezum is a steam-based treatment of the prostate, where we go through the urethra and we use a little needle to treat the tissue that's blocking the flow of urine. With short bursts of steam in what's a relatively short procedure, that tissue is basically killed and the body absorbs that over the next few weeks. Patients have to use a catheter for a day or two, but afterwards symptoms start to improve without the need for a major surgery and allowing many men, to stop their medical therapy. There's also a procedure that's in the MIST category called UroLift, and the procedure itself is called the prostatic urethral lift procedure, or pull procedure. That's done in a way where we use little tacks, these UroLift implants, to lift the prostate out of the urethra to allow the urine to come out faster. It's a very short procedure. It does involve placement of these implants, but gets patients a quick improvement in symptoms with minimal side effects. One of the advantages of the MIST procedures is not only having a shorter procedure time and fast recovery, but also these do not affect ejaculation. And because the prostate is the gland that causes men to ejaculate or allows us to ejaculate, having treatment options that preserve that when it's important to a patient is good. So even if these MIST procedures are kinder and gentler to the prostate, they can still improve the symptoms, preserving ejaculatory function. May not be right for everybody. So it's good to be in a practice where you can discuss these options with your urologist, because there's so many different ways to treat the enlarged prostate that you have to pick something that's good for you and good for the size and shape of your prostate and appropriate for what you're looking to get out of your treatment. So these are all available at Houston Metro Urology, and you can learn more at www.hmutx.com.